My name is Megan, and this is my NG tube insertion and removal. Okay, I've already got my doctor's order to insert the NG tube, and I've already gathered all my supplies, so now I'm going to go ahead and do my initial implication steps. Knock, knock. Entered, wash my hands. Hello, patient. My name is Megan. I'm going to be inserting your NG tube today. Can I go ahead and check your name, date of birth, and do you have any allergies? No? Okay, perfect. It looks like you are who you are, so we're going to go ahead and proceed. I'm going to go ahead and raise the bed. Bed rails down. And first, I'm going to check the bowel sounds. Okay, it looks like all 4 quadrants are within normal levels. So now I'm going to go ahead and measure out my NG tube, starting at the nose, going to the earlobe, and then down to the xiphoid process. And then I'm going to go ahead and mark that with a piece of tape. Okay, now that it is marked, I'm going to go ahead and put on my gloves. Have you had any nasal surgery? No? Okay. And do you have any stuffy nose or anything this morning? No? Okay, so I'm good to do either nostril. So I'm going to go ahead and have you lean back while I insert it and hit the top of the bridge of your nasal. And once I do that, I'm going to have my assistant assist you with some water. You're going to relax and keep swallowing, swallowing, swallowing while it goes down your throat. So I'm going to loop the NG tube 3 to 4 inches on the end. Alrighty, and I'm going to have my assistant come over and assist you with some water once we get it up to your nasal bridge. Okay, you've hit the nasal bridge, so I'm going to have you keep swallowing, relax, and I'm going to keep pushing. And I'm going to insert it as far as I can to the tape on the NG tube. Okay, on the mannequins, it won't let me do it quite as far as I need to, but in a real life scenario, I would have the tape go all the way to the nose, and then I would use my pants to secure it. Okay, and once I've done that, I would mark it with a permanent marker and measure the rest of the length of the NG tube. So now that that is secure and that's all in, I'm going to go ahead and check the pHs. So I will unclamp it. Alrighty, and once I've got that on, I will reclamp it. And then I will go ahead and make sure that my pHs are between 1 and 4. So it looks like it's good. And just to confirm that my NG tube is in the right place, I'm going to have the radiology department come up, do a x-ray, and once it's good, I'm going to send that down to the lab. And once I make sure that's all secured, then I'm going to go ahead and do my ending implication steps. Okay, so then I'm going to ensure my patient's safety, make sure this is pinned on to his gown. Got that pinned. Okay, and then just pin that up, lower the bed down. Give him his call light and document anything I've done. So then for the taking out of the NG tube, I'm going to make sure I have the physician's order, come in, do my same steps, make sure my hands are washed, make sure I have my right patient, check my patient, make sure there's allergies. Then I'm going to put on new gloves, and then I'm going to irrigate 10 milliliters. once that is irrigated, then I'm going to go ahead and have a warm washcloth, oral care supplies, and water for when I'm done with it. So I'm going to go ahead and take off the tape carefully. I'm going to have my patient hold his breath while I take it out. And I also have a towel ready so that I can get anything that comes out with it and get it out. So I'm going to have him hold his breath. This, put it in the biohazard when I'm leaving. Give the patient a warm washcloth if he needs it. And then give my patient oral care if he needs it, and give my patient water if he needs it. And then I am going to assess the bowel sounds. Okay, it looks like all 4 bowels are within normal levels. So then I'm just going to make sure I ensure my patient's safety before I leave. So then I'm going to lower the bed back down, make sure the bed rail is up, give him his call light, make sure he has anything else he needs, the water, and put all my supplies into either the biohazard or the trash can. And then I'm going to make sure I wash my hands and document when I'm leaving.